Thanks so much. So I want to start by acknowledging the significance of today, the 60th anniversary of the Medicare and Medicaid programs. So over these 60 years, both programs have supported the services, supports, and care of literally millions of older persons. They are a lifeline. Medicaid is the primary payer of long-term services and supports. There is simply no other public option for the services provided in a range of care settings, including nursing homes. So now let's talk about need. At present, older adults over age 65 represent nearly 20% of our population, and that percentage is steadily increasing. And as it does, the demand for services and care will grow. At Leading Age, our nonprofit and mission-driven, community-based member organizations are committed every day, as they have been for decades, to meet that demand, whether it be for care in a nursing home, home care in a private home, through PACE programs, or adult day centers. Our members depend on Medicaid payments to deliver care and services, payments that, even before the cuts, did not cover the full costs of care. The undeniable fact is America's infrastructure of services and supports for older people was inadequate and unsustainable before passage of the 2025 Budget Reconciliation Act. The changes called for in the Act, and now law, will weaken the existing system at a time when demand for services and supports is growing. Who will older adults and their families turn to when the services they need are not available because the funding has been cut? And when providers of services can no longer deliver them and have to shutter their doors? What will happen to the staff who are employed in many of these settings and who may themselves be on Medicaid or have family members who rely on it, who are now at risk of losing their health care coverage or possibly seeing their wages reduced? Here's the truth. The Medicaid provisions in this bill plain and simply erode an essential program, truly a safety net for millions of older people. As states respond to HR1, the changes will create craters in their budgets due to reduced federal Medicaid contributions, and the effects will be felt by older adults and their families. And here too, demographics don't lie. As the number of people over the age of 80 increases, the number of people of caregiving age, 24 to 65, shrinks. The supply of available caregivers is not keeping up with the growth of the older population. This is not a math problem. This is a reality that directly impacts our families, financially, emotionally, and practically. Out-of-pocket costs, time away from work, or even lost jobs. Medicaid cuts, which have been framed as a cost savings, will result in an enormous expense to America's families. Today, I'm joined by two Leading Age members who will share the impact of HR1 on their services. While aspects of the impact are yet to be discovered, what we do know is that this legislation will establish more hurdles for providers, whether through shortened retroactive eligibility or limits on the provider taxes states rely on to fund Medicaid, or by the financial decisions states are forced to make. We can only look to history to understand this. Historically, states' response to budgetary pressures have been to cut Medicaid eligibility, to shave benefits, or to cut provider payments to cover the costs of delivering care, which means fewer dollars to pay staff.